Hello, Mr. Dr. Lee Frank Jan. Welcome in Bangladesh and welcome in SA Television.
Thank you so much. Thank you for having me.
For a microphone,
Okay, all right. Yeah.
Okay, Mr. Lee Frank Jan, do you think that the prostate cancer is increasing day by day? And if it is, then why?
Well, thank you for the question. Most definitely, prostate cancer incidence is increasing over the decade. Within the Western population, it is the number one and top cancer in Western men. And in Singapore, it is actually number two. In Bangladesh, when I look it up, it is number 17th in the most frequent cancer in Bangladeshi men. And one of the main reason is because the lack of screening and testing, and of course the poor awareness of the condition by the population. But with increased affluence, with increased understanding of the disease, you will find that the number of cases that is being diagnosed and picked up will increase.
Oh, then what is the advanced diagnostic, therapeutic, and surgical options you have in Singapore to diagnose and treat the prostate disease?
Yes, okay. One unfortunate thing about prostate cancer is there is a blood marker that is available to detect that there's any abnormality within the prostate. This is a test called prostate-specific antigen that's available to screen and test patients that come through to see whether they are at risk of harboring prostate cancer. And if they are at risk, if this marker is high, then a lot of times the doctor investigating this patient will send them for advanced imaging such as MRI, scan of the prostate to detect any cancer that is within the prostate. And if there is suspicious lesions, then they will undergo biopsy to confirm the lesion and undergo treatment subsequently.
Okay, what has made robotic surgery advantage compared to the conventional surgeries for prostate cancer?
Okay. The conventional surgery, or how we treat cancers, is through open surgery, which requires a big wound in the abdomen, big enough for both our surgeon's hand to go inside to perform the surgery. Okay. The surgery can be done, definitely, but of course, what's the expense? What is that, you have a big wound, the risk of bleeding tends to be higher, and you take a longer time to recovery following surgery. And with advancement in our surgical techniques and training, okay, we have, for a lot of these surgical procedures, we've moved on to keyhole surgery. So you heard of keyhole surgeries, in medical terms, there's laparoscopic surgery. What that entails is actually putting little trocars into abdomen, and which you put instruments inside there. They're little chopsticks that we use to control externally to perform the surgery. Robotic surgery is a very advanced form of this keyhole surgery, whereby the instruments that are inserted actually has little arms that we can manipulate in a bigger degree of motion. Okay, that helps with the surgery. Okay, obviously the urologists or urology surgeons are the biggest users of this robotic surgical technique because this instrument is very useful when operating in confined spaces. Okay, the prostate is found within the pelvis, which is a very narrow space, and in order to remove it, it actually requires a lot of dexterity in the laparoscopic instrument. Okay, and having had the prostate efficiently removed, we need to join the bladder back to the urethra to maintain continuity of the urinary tract. And that suturing process is best executed with the robotic instruments, but a lot better than the laparoscopic instruments. We can do a lot finer surgery, more accurate suturing to ensure that the healing is better and hence less complications following the surgery. The patient tends to better outcomes in terms of urinary continence. They have less chances of leakage after surgery, and under the magnification of the robotic surgical vision, we can actually see the area that we operate on a lot clearer and preserve the nerve better and hence maintain erectile function for the patient.
Okay, in that case, I mean, robotic surgery, then how long a patient need to stay in the hospital?
Okay. The usual stay for a robotic prostatectomy or robotic prostate excision surgery, the inpatient stay is about 2 nights, which is a lot faster than our typical open surgery. You can imagine with a big wound, the patient tends to have a lot of pain, and usual stay after open prostate removal surgery range from about 5 to 7 days.
Dr. Lee Jed Frank, what is the common causes of recurrent urinary tract infection in women, and what is the consequence if it is left untreated?
Okay, all right. As we all know, okay, you have lady friends, you find that the ladies tend to have urinary tract infection more often than men. And one of the main reasons is, of course, the urine passage or urethra is a lot shorter in females compared to men, okay? And most of this urinary tract infection occurs because bacteria, okay, attack the bladder or urinary tract from external to internal. So with a shorter urinary tract, they have more time to get into the bladder and cause problem, okay, compared to in a man, whereby when the urinary tract is longer, it takes a longer time for them to get to the bladder. A lot of times when, before they get to the bladder, the man will pass urine and will flush the infection out, okay, all right. And why women get it? There's quite a few reasons for that, okay. We find that the risk factor for recurrent urinary tract infection include in women with a postmenopausal state. Postmenopausal means they have passed the childbearing age, they have gone into menopause state, and that state of health results in change in hormonal and environment around the vaginal region. And that actually increases the risk of hostile bacteria hanging around and causing an infection. Okay. Other risk factors why ladies do get it can be associated with menstruation. Some ladies get it around the time of the month when they are menstruating. Okay, so the blood medium is a very rich medium for bacteria to propagate and cause infection. All right. Another risk factor will be sexual intercourse. Some ladies do get it. They find that they frequently get it after sexual intercourse. Okay, the act of sexual intercourse occasionally push some of the bacteria from external opening of the urinary tract into the bladder. And if the lady, after sexual intercourse, do not empty the bladder and go to sleep straight away, that's when they tend to get urinary tract infection a lot more often. Okay, as a urologist, a lot of times when the lady comes for evaluation, we need to evaluate to look out for structural problem. Okay, that predispose them to urinary tract infection. Things like if they have urinary stones, either in the bladder or in the kidney, so those foreign bodies actually harbors bacteria very easily and makes it very hard to treat. So after having had antibiotics course of treatment, those bacteria tend to hang around and actually reinfect them quite easily. Other factors include some ladies have problem emptying the bladder. So if they are unable to empty the bladder, any bacteria that gets into the bladder will stay there and propagate, right?
Remaining answer, the consequence if it is untreated.
Yes, okay. So if a urinary tract infection is not treated, and typical symptoms of how the lady will know they have urinary tract infection, that includes painful urination, very frequent and urgent urination, blood in the urine, and of course, at a later stage, fever. All right. So if it's not treated when it's still in the early stage, the condition can progress to the point whereby the bacteria gets from the bladder, climbs up the urine tube, and attacks the kidney. That's when potentially the patient can get very sick, have high fever, requiring admission to the hospital, and even ICU stay in sometimes. All right. And recurrent infection to the kidney eventually can result in kidney disease, and in in a worst case scenario, kidney failure. So those can be very serious conditions.
Okay. Dr. Lee Feng, we know you are working as a senior consultant in urology under Farrer Park Hospital, Singapore. So what is the difference, or what is the specialty of this hospital, and why people choose this hospital for their treatment?
Okay. Farrer Park Hospital is the latest and newest private hospital in Singapore. It is approximately 5 to 6 years old, and you have the latest facilities, latest instruments, very young and vibrant team of doctors, as well as nursing staff to take care of the patient's needs.
Okay, then finally, what is your suggestions for our viewers to protect themselves from prostate disease and urinary tract infections?
Okay, so my advice is to educate yourself on some of the common symptoms related to these health conditions, be it urinary tract infections or prostate disease. Keep a lookout for them, and if you do find that you have these symptoms, do seek out a doctor for evaluation early. So especially for cancers, okay, late diagnosis, okay, will result in a later stage cancer being diagnosed, and that actually spells a very, very poor prognosis and very difficult treatment.